For question one, the main factors that contribute to Patrick's respiratory systems included dyspnea, history of smoking for a long period of time, COPD, left-side heart failure, and consistent coughing. Patrick's history of smoking has set off his COPD, which has caused irreversible damage to his airways, causing emphysema and chronic bronchitis. Emphysema can result in damaged alveolar walls, broken down elastic fibers, and can lead to airways collapsing during expiration, which can be also a result of Patrick's dyspnea. Chronic bronchitis is inflammation of the bronchi, which results in the productive cough Patrick suffers. Chronic bronchitis can also result in excess amounts of mucus building up and blocking the airways. Patrick may also be suffering from pulmonary embolism. Clinical features of pulmonary embolism include shortness of breath or chest pain, dyspnea, possible hematosis, and may result in right side heart failure. Patrick is also showing symptoms of pulmonary oedema. Pulmonary oedema can result in excess buildup of fluids in the lines of the alveoli and is also a result of COPD and PE. Patrick has had a myocardial infarction on his coronary artery in the past. Patrick may be suffering from tachycardia. Tachycardia occurs when the heart rate exceeds the standard heart rate of the age group. Patrick has also experienced left-side heart failure. Left-side heart failure is a result of pulmonary edema, dyspnea, and fatigue. Patrick is at risk of developing further heart issues and respiratory issues if not treated. One of the likely causes of COPD can be long-term exposure to cigarette smoking. With a long history of smoking, the normal function of people's lungs is reduced. The history of smoking can be determined by the number of years a person has smoked and how many packets a day they have smoked. Emphysema is an airway obstruction, which is a serious condition related of COPD that can be caused from years of smoking. Fragile walls and elastic fibers of the alveoli are damaged due to this lung disease. This makes it difficult for the airflow exiting the body due to the small airways collapsing during exhalation. Other factors that can contribute to development of COPD are genetic susceptibility to the diseases such as an alpha-1 antitrypsin deficiency, which is an uncommon genetic disorder. COPD can develop over years and symptoms can start to begin to show in people who are at least 40 years or older. Symptoms that Patrick shows in relation to COPD is a shortness of breath, constant coughing that produces mucus, swelling in ankles, feet, or legs, and a lack of energy. The failure of the heart can often be related to another illness or disease such as coronary artery disease, which is one of the most common causes. CAD is a disorder that causes the arteries that supplies blood and oxygen to the heart to become narrow. Left-side heart failure is a process, not disease, that gradually weakens the left ventricle, which is mainly the heart's pumping power. Normally, oxygen-rich blood is pumped from the lungs to the heart's left atrium, which then goes into the left ventricle to go into the rest of the body. Symptoms that Patrick shows in relation to having COPD are shortness of breathing, swelling in the legs, ankles, and feet, reduced ability to mobilize, constant coughing, swelling of the abdomen, fluid retention due to rapid weight gain, and chest pain. The likely causes of left-side heart failure for Patrick are cardiomyopathy, coronary artery disease, diabetes, high blood pressure, obesity, and tobacco use. One of the serious symptoms that COPD and heart failure have in common is difficulty breathing. Sometimes a combination of both conditions can cause the shortness of breathing. However, it is difficult to know exactly which condition is causing the breathing problem. Shortness of breath caused by physical activity, such as exercising, climbing stairs, or long distance walks, can occur in a person who has COPD or heart failure. Exhaling all the air in the lungs may be hard for a person with COPD due to the damage to the lungs from smoking for a certain amount of years. Active people with COPD may have shortness of breath due to the air entering before the person has a chance to exhale. This traps the oxygen, complicating the pathways and causing damage to the tissues in the lungs. During physical activity, the heart must pump harder and faster so the blood flow can be increased. Blood doesn't pump as efficiently as it should when a person has heart failure. This may make the heart not strong enough during physical activity, which causes blood to back up into the lungs and can cause shortness of breath. People who have COPD and/or heart failure can also breathe easier when they are resting. Despite having breathing problems as a common symptom, COPD is not directly related to heart failure. However, both disorders can influence each other. An example of this may be COPD, which causes low oxygen within the blood, which can put extra strain on the heart, worsening the condition of the left side of the heart, increasing risk of heart failure. Due to the heart failure, high amounts of fluid within the lungs can make breathing even harder if the person has COPD. Interpreting Patrick's results can show many risks for right-side heart failure. The edema in Patrick's legs is a very important risk factor for right-side heart failure. Edema is a result of sodium retention, which, as a result of water following sodium, causes fluid to be retained in the body. Using his blood test, his sodium levels are very high. Leg edema occurs when the right side of the heart isn't pumping blood effectively. As a result, blood needs to be pumped more effectively, so norepinephrine alpha receptors send a signal to vasoconstrict the vessels, forcing more blood through these vessels by pumping at a quicker rate, hence Patrick's high BP and BPM. This forces fluid from the blood vessels into body tissue, which causes swelling and edema, mostly in the feet and the legs, causing Patrick's edema and improving his weakness of the right side of the heart. Another factor that puts Patrick at risk of right side heart failure is lung disease, in which, due to COPD and his 40 years of heavy smoking, which puts him at immediate risk of emphysema. Due to COPD, he has low oxygen intake, which causes a rise in blood pressure, as seen in Patrick's BP, in the arteries of the lungs. This is known as a condition called pulmonary hypertension, which increases the pressure and causes strain in the right ventricle of the heart as it tries to pump blood through the lungs. This causes a weakening in the heart muscle and as a result can cause right side heart failure due to these complications. Firstly, Patrick's hemoglobin levels were quite low, standing at 111 grams per liter instead of the average hemoglobin level of 130 grams per liter. Hemoglobin is a protein which carries oxygen around by red blood cells to the rest of the body. Due to COPD's demand for red blood cells as a response to increased respiratory rate, due to increased oxygen intake, high BP and BPM, bone marrow can't adequately respond. This causes low hemoglobin levels, which causes anemia, which is a low level of red blood cells and iron. Anemia as a result causes dizziness, fatigue, lightheadedness, or malaise. Patrick glucose level, HDL triglyceride, and LDL results were all abnormal, which can cause high cholesterol levels and high blood pressure. These point towards diabetes mellitus, which would make sense as Patrick is also overweight, as stated by his BMI of 29.3, as well as a high cholesterol level, which is directly linked to diabetes. This evidence is backed up with the fact that his good cholesterol levels are significantly lowered, as shown by his results of LDL and HDL. His high triglyceride levels are due to his diet, as triglycerides subside in the forms of fats in butter and oils, which can also be supported by his increased waist circumference of 104 centimeters, which points towards belly fat, high glucose levels, high BP, and low HDL, which are all symptoms. Diabetes can cause fatigue, which would explain his feeling of constant tiredness. Patrick's sodium and potassium levels were all irregular. These are important for water balance and acid-base balance in the blood and tissue. Too much sodium and potassium in Patrick's instance causes dehydration due to their importance in fluid balance, and as a result of his edema being a major contributor. The body's sodium level is a clear indicator that there is a lack of a hormone called the antidiuretic hormone, which plays a role in water reabsorption in the kidney. This can cause the kidneys to try and get rid of too much water, causing dehydration, as a result causing neurological effects such as lethargy, confusion, and weakness. Finally, looking at his calcium levels, they were extremely low. Calcium deficiency is directly related to vitamin D deficiency, which is involved in helping in the reabsorption of calcium by sun and nutrition. Using Patrick's blood test results shows that he suffers high cholesterol level, overweight BMI, and high waist size, which relate to his high fat total. His dyspnea and struggles to walk affect him from doing physical activity, so there is a high probability that he doesn't receive sufficient amount of sun and of vitamin D from foods due to evidence in his blood tests. Vitamin D deficiency and hypercalcemia are both related to diabetic patients, which could bring along symptoms such as tiredness. Bicarbonate in relation to blood pH is an additional blood test that is likely to be abnormal, as it will be higher than usual. The normal ranges for bicarbonate within the blood is 22 to 26 millimole per liter. Metabolic alkalosis occurs when the level of bicarbonate within the blood is high. This condition can cause the pH level within tissues to be increased due to loss of acid within the body. COPD can be related to this condition.